Hello, and welcome to the California Community College Athletic Trainers Association COVID-19 educational session for student athletes. Today we're going to go over COVID-19, prevention, mythbusters, treatment, personal responsibility, and fluidity. An outbreak of unusual respiratory disease initially dominated by pneumonia in Wuhan, China, is caused by an infection of a novel coronavirus. The new virus was initially named 2019-nCoV by the WHO. On February 11, 2020, WHO renamed the disease as Coronavirus Disease 2019, or COVID-19. COVID-19 is a large family of viruses common in both people and animals. The most common coronavirus cause the common cold in humans. COVID-19 is caused by a virus that has been named SARS-CoV-2, which is in the same family of viruses as SARS and MERS. COVID-19 is a respiratory disease that's being spread by a new coronavirus that emerged in 2019. It affects both the upper and lower respiratory tract. It is a virus, meaning that there is no medication or drug to cure COVID-19. Medication can only be used to treat symptoms. Speaking of symptoms, some signs and symptoms of COVID-19. These are the most common signs and symptoms, but they are not the only ones that are present with this illness. Cough, fever, repeated shaking with chills, headaches, loss of smell, severe vomiting, shortness of breath, chills, muscle pain, sore throat, loss of taste, or diarrhea. People with COVID-19 have had a wide range of symptoms reported, ranging from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms may have COVID-19. Other less common symptoms have been reported, including gastrointestinal symptoms like nausea, vomiting, or diarrhea. High-risk individuals. Just because you're not in the high-risk group does not mean that you cannot contract COVID-19 and suffer complications. Everyone can contract COVID-19 and transmit it. Chronic lung disease, moderate to severe asthma, serious heart conditions like coronary artery disease, congenital heart disease, or cardiomyopathies, immunocompromised individuals, severe obesity, diabetes, chronic kidney disease, or liver disease. People who are more likely to suffer illnesses from contracting COVID-19 are people that are over 65 years, or who live in nursing homes or long-term care facilities. Note, many of you may live with, know, or come in contact with these high-risk category people. Call 911 or call ahead to your local emergency facility and notify the operator that you are seeking care for someone who has or may have COVID-19. COVID-19 complications. It can cause complications that affect multiple systems in the body. The complication can include, but are not limited to, acute respiratory failure, acute respiratory distress syndrome, viral pneumonia, acute kidney injury, acute liver injury, secondary viral and bacteria infection, septic shock, abnormal blood clots that can lead to pulmonary embolism or stroke. There are different ways that COVID-19 is transmitted. From person to person, between people who are in close contact with one another, respiratory droplets produced when an infected person coughs, sneezes, or talks. Droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into their lungs. COVID-19 can be spread by individuals who are not showing symptoms. Contact spread, so you can get COVID-19 by touching a surface or object that the virus is on, and then touching your own mouth, nose, or eyes. The amount of time that a virus can live on surfaces depends on the material of the surface. 72 hours on plastic and stainless steel, less than 4 hours on copper, and less than 24 hours on cardboard. To prevent COVID-19, currently we are avoiding large events and mass gatherings, avoid close contact with sick individuals within 6 feet, wash hands with soap and warm water for 20 seconds, or use alcohol-based hand sanitizer made with at least 60% alcohol. Avoid touching your mouth, eyes, and nose. Avoid sharing personal items like water bottles or towels. Clean and disinfect high-touch surface areas as needed, for example, tables, doorknobs, desk, sports equipment. And avoid going to work, school gatherings if you are sick. One of the other ways we can prevent COVID-19 is to do hand washing. This is from the Center for Disease Control on what you need to know about hand washing. Why should I use soap and water to wash my hands? Germs can get onto your hands and items you touch throughout the day. When your hands may be dirty, it is best to wash with soap and water to remove whatever germs and chemicals that are on your hands. Warm or cold water? Either is fine as long as it is clean. Bar soap or liquid? Either is fine. Does the soap have to be antibacterial to work? No. Plain soap and water works just as well. What if I don't have soap, but I have access to water? Using soap to wash hands is more effective than using water alone, but if water's all you have, rub your hands together under it and wipe off with a clean, dry towel. When hands are not visibly dirty, you can use an alcohol-based hand sanitizer that contains at least 60% alcohol. How long do I need to scrub when washing my hands? Scrubbing your hands for at least 20 seconds is most effective. Do I have to clean under my fingernails? Yes, germs like to hide under fingernails. Make sure to clean there too, as well as the back of your hands. Towel or air dry? Either is fine, but if you're using a towel, make sure it is clean. Should I use a paper towel to turn off the faucet or open the door of a public bathroom? There isn't much scientific evidence about this. If you're concerned about getting germs on your hands after you wash them, you can use a paper to handle the sink or door handles. What if I don't have soap or water to wash my hands? If soap and water are not available, use an alcohol-based hand sanitizer of at least 60% alcohol. Alcohol-based hand sanitizers can quickly kill most types of germs on the hands, but may not kill certain bacteria and viruses that cause diarrhea. Protect yourself and others by washing your hands with soap and water. Learn more about the magic of hand washing from the U.S. Department of Health and Human Services, CDC. Another thing you can do to help prevent the spread of COVID-19 is make sure that you're wearing if you are wearing a face mask, to wear it properly. The picture on the right shows correct and incorrect forms. Make sure your nose and mouth are completely covered by the face mask. Do not touch the mask while using it, and if you do, wash your hands. Remove the mask from behind the earlobe. COVID-19 versus flu and allergies. We realize and recognize that there are a lot of signs and symptoms that could be misconstrued. We want to kind of eradicate any of those issues. Coronavirus has a fever, cough, shortness of breath or difficulty breathing, and symptoms appear 2 to 14 days after exposure. Whereas flu, you have the fever and cough, but with that you will have muscle aches, fatigue and weakness, chills and sweat, congestion, and sore throat. Allergies, on the other hand, you will be sneezing, have itchy nose, eyes, or the roof of the mouth, as well as a runny, stuffy nose, and watery, red, or swollen eyes. Some of the mythbusters that we took from the CDC website was, there are currently no drugs licensed for treatment or prevention. Adding pepper to your soup or other meals does not prevent or cure COVID-19. COVID-19 is not transmitted through houseflies or mosquitoes. Spraying and introducing bleach or other disinfectants into your body will not protect against COVID-19. Drinking methanol, ethanol, or bleach does not prevent or cure COVID-19. Cold weather and snow cannot kill the new coronavirus. High temperatures or humid environment does not prevent the spread of COVID-19. Drinking alcohol will not protect against COVID-19. Treatment. What to do if you are sick. Make sure that you stay home except to get medical care. Most people have mild illness, can recover at home. Do not leave unless it is to seek medical care. Avoid public areas. Get rest and stay hydrated. Take over-the-counter medicines like acetaminophen to help with symptoms. Stay in touch with your doctor and athletic trainer. Avoid public transportation. Separate yourself from other people. As much as possible, stay in a specific room and away from other people and pets in your home. If you must be around other people, wear a face covering. Make sure you communicate with your coach and athletic trainer before you go to campus if you are having any signs or symptoms or feel that you are sick. Monitor your symptoms. Keep track of all your symptoms and be aware if they worsen. If symptoms worsen or you believe you have an emergency warning sign, seek medical attention right away. Some of the emergency warning signs are troubled breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, bluish lips or face. We encourage you to document any of those signs and symptoms and when you first started having them. Personal responsibility. If you are sick, even if it's just a cold, stay home and stay away from your teammates. Make sure you notify the athletic training staff and coaching staff about any illness or exposure that may have happened. Sneeze and cough into your elbow or tissue. Wash your hands often or use hand sanitizer if soap and water are not available. Wipe down high-touch areas such as doorknobs, cell phone, tablet, and tables, as well as shared practice and game equipment. If you are rooming with a teammate, try and isolate as much as possible. Wear a mask if you must be outside while sick. Ensure that the mask covers your mouth and nose. Be honest about how you're feeling and who you've been in contact with. Follow rules and restrictions of the athletic training clinic at all times. Whenever you're in doubt, just ask. Make sure you review the earlier slide on hand washing and mask use. Another thing to take into consideration is fluidity of COVID-19. Remember, it is an illness caused by a novel coronavirus. New information is constantly emerging and guidelines are continuously changing. Because of that, education will be ongoing. To stay up to date, you can visit the Center for Disease Control website at cdc.gov or the World Health Organization website at who.int. Here are some of the references we used, but whenever you're in doubt, please make sure you reach out to your coach and your athletic trainer. Thank you and have a good day.